Okay, so first off, let's just take a moment to talk about the anatomy and biomechanics of breathing. Now, it's really important that you understand exactly how this works, since we do breathe roughly on average about 20,000 times a day. So, any sort of altered biomechanics or inability to understand the anatomy behind breathing can really result in a lot of movement compensations and poor movement patterns throughout just one's day, let alone one's week, month, year, and life. So let's start by talking about the respiratory diaphragm. As you know from anatomy, the respiratory diaphragm is really kind of like a dome-shaped muscle that sits just about at the bottom of the rib cage, but kind of comes up into like kind of near the xiphoid process or roughly there, depending on each individual person's anatomy. It's a little bit more domed on the left side than it is the right side, and that's just because we are asymmetrical beings, and that's just how it is. But contrary to what you might think based off of that, because the liver is over here, as it descends or contracts, it's going to kind of go flattening. And the left side will actually have a little bit more movement capacity simply because it's not pushing against a giant solid liver all the time. It's much easier to push against the spleen and the stomach and the pancreas on the left side. But we also have six other diaphragms throughout the body, and that's not what we're going to talk about here. But one that we will talk about is the one that's kind of at the thoracic inlet or outlet, depending on how you want to look at it. So the respiratory diaphragm can really only descend or contract at a certain rate. If you're curious about what rate that is, plug one of your nostrils and breathe in, and that's the rate that the respiratory diaphragm can really contract at. Past that, we're starting to recruit mainly this cervical or thoracic diaphragm, depending on how you want to look at it. As this one moves, it will definitely allow us to get air in, no doubt about that, but we are pulling upwards and we're going to have to recruit some of the muscles up here. If you're familiar with like DNS, they term this reclination, which is like that sort of position. Anyways, that's just to say that really we want to be breathing with the respiratory diaphragm as much as possible throughout most of our lives, unless we're doing something athletic or something just like a little bit more higher intensity. Or really if you're like in like a high psychological stress situation, such as like taking a test in an interview, maybe you're like new to practice or new to working with people and you're just like, okay, that up here, and that's less than ideal for an everyday situation. So when the respiratory diaphragm contracts or flattens out, it pushes pressure downwards and creates a vacuum throughout the thoracic cavity. When you create that vacuum, nature hates a vacuum, abhors a vacuum, and will pull air in from your mouth or your nose into the lungs. Okay? So, as you know, the lungs have no real contractile properties. So, as that respiratory diaphragm goes down, it creates a vacuum, and air therefore is forced into the lungs and forced into the alveoli, where respiratory gaseous exchange takes place. Now, if you do breathe up, we are still creating a vacuum because we are creating expansion through the thoracic cavity, and we still will get air in, but it's through a whole different set of respiratory accessory muscles, which can cause just overuse injuries and strain because they're really not meant to be contracting all the time. Okay, that's why we have this giant respiratory diaphragm, and we have a very small diaphragm up here with a lot of accessory breathing muscles, such as the scalenes, the levator scaps, okay, subclavius, the pecs, the traps, okay? These are all muscles that are not meant to be constantly going through a concentric and eccentric contraction all day, okay? So when doing that, they get a little bit fibrotic and they get a little bit contracted and can develop contractures, and that's where we start to have this, okay? So as you can imagine, if these muscles are tight, okay, I can't move around very efficiently. That's going to cause things like joint restrictions as well as ischemic compression, basically, of the nerves and the muscle cells associated with those areas. And then that's just going to cause pain and fatigue, stiffness, soreness, you name it. basically the symptoms that your patients will probably present with you when they have an upper back or neck complaint without trauma or some sort of like repetitive athletic overuse injury or something like that. So back to the respiratory diaphragm. So the respiratory diaphragm, if you look at an anatomy book, kind of goes from like here up and back. So it actually goes down farther in the back than it does in the front. What this does is that when it flattens, it actually pushes a little bit posterior to anterior as it goes from superior to inferior. So when we think about this, when we push down and we're pushing downwards at an angle, we're going to get most expansion kind of on the lateral and anterior sides of the like abdominal region. This is why we have more of a bucket handle expansion on the sides and a pump handle expansion on the front. And we don't really talk about like the thoracic or lumbar vertebra pushing backwards. Now, that does not mean that we do not have posterior expansion of the abdominal cavity. There will be posterior expansion, it's just mostly going to be lateral and anterior. One thing we want to think about though, and this is where kind of like things like yoga or Pilates or whatever may not be totally accurate, is that when pushing down, right, it doesn't make any sense from a physics perspective that you should get air only into certain areas, right? That would create imbalances. So when pushing down, the air should get everywhere. It should get all the way down into the pelvic floor, and that should kind of create an eccentric contraction of the pelvic floor muscles, which is going to be super important for both male and female pelvic floor health, as well as genitourinary health and stuff like that. As the respiratory diaphragm contracts and pushes that volume of the abdominal cavity down, you will get a lot of like movement of the abdominal organs, such as the intestines and the colon, or the small intestine and large intestine, however you want to think about it. And that sort of movement is really effective and important for digestion and normal organ health. So beyond just getting air in, it's vitally important for our overall whole person health to have proper breathing patterns where we're getting that expansion both anterior, lateral, and posterior through the abdominal cavity for breathing and for organ health. But again, to digress a little bit, so we really want to make sure that we're getting air all over the place. So if you're just doing like a belly breath like they teach in yoga, okay, I can push out my belly, but I'm not actually breathing into that area. Okay, so if you're only getting belly breathing, you're not actually getting true diaphragmatic breathing, because true diaphragmatic breathing should have a 360-degree presence of expansion.